Many people living with MS experience problems related to sexual function. Marie Namey, a nurse who has worked with MS patients for over 30 years, talks about the importance of communication with partners and healthcare professionals to identify and address sexual issues commonly experienced by patients living with the disease.
It's been said that people seek physical closeness to fulfill many needs. We need to continue to fulfill the needs for affection, touch, and love, even when the demands of life, aging, and illness appear. Hello, my name is Marie Namey. I'm an advanced practice nurse at the Mellon Center for Multiple Sclerosis Treatment and Research at the Cleveland Clinic. I've been specifically working in the care of folks who have MS since 1985. Yeah, 1985, a long time. In 1985, we did not have the disease-modifying therapies that we have today. What we did have were treatments for relapses, and we also had treatments and management for many of the symptoms. But a symptom that we did not talk about much at that time, and I think that is overlooked still today, is that of sexual function and intimacy. Symptoms of MS come from the brain and the spinal cord, and the symptoms of sexual function concerns also come from the brain and the spinal cord. And these symptoms affect quality of life, yet they're not discussed that often. I know this is a sensitive and intimate topic, but I'd like to open up that discussion today. Sexual function and intimacy matter. Sexual dysfunction can lead to personal difficulties as well as relationship concerns. My focus today is to open up a discussion with you about intimacy and sexual dysfunction so that you can be educated and empowered to speak to your partner and your healthcare provider about these concerns. I'd also like to give you some suggestions, some recommendations to improve your own sexual function concerns. But first, let me tell you about Tracy. Tracy's a 42-year-old woman. She's divorced and she has 2 teenage children. She's been a patient of mine for a number of years. She came into an appointment a number of months ago as we had started her on a new disease-modifying therapy, and we wanted to make sure that she wasn't having any side effects and that she was tolerating the medication well. She comes in my office, we talk about the medication, I complete the neurological examination, we talk about a few other things, and toward the end of the visit, I say, is there anything else you'd like to discuss today? And Tracy looks at the floor, and she looks up at me, and she looks at the floor again, and she wiggles around in her chair. And she said, well, there is something I want to discuss, but I don't even know if my concern is related to multiple sclerosis, but I need to talk to somebody about it. And she proceeded to tell me she started a new relationship, she was involved with a man, and they started to have a sexual relationship. But she said, you know, sex isn't like I remembered it to be. I'm not just feeling the pleasure that I used to with sex, and I don't want to lose this guy. Do you have any suggestions? Do you know if you can help me? So first of all, I congratulated Tracy for talking with me about this sensitive subject. I reminded her that sexual function concerns are very common in individuals with multiple sclerosis, and most likely her concerns are due to multiple sclerosis. I asked her a few more questions. She gave me a few more pieces of information about what was going on, and in the end, I suggested that she and her partner have a talk. Just as she felt open with me about talking with these concerns, she talked to him about it. I also suggested that she go to the drugstore and buy a water-soluble lubricant and try it. Not just a little bit, but enough to make sex a little bit more pleasurable for her, more comfortable for her, and hopefully she'd be able to achieve orgasm, which was her goal. Tracy came in to see me again a couple weeks ago. She was smiling. She and her boyfriend have had this great continued relationship, and she was very grateful for the suggestion I had. And in fact, now she and her boyfriend were looking on the internet to find other sexual devices that could potentially improve their sexual life. This is not a typical scenario, though. This usually doesn't happen when a person with MS comes in to see their healthcare provider. Why is that? I've wondered myself over the years. There were surveys that were done a number of years ago asking patients and asking healthcare providers why this topic is overlooked. Patients actually say they're embarrassed to bring up this topic. They also say that they're not sure these concerns are due to multiple sclerosis, and maybe it's not appropriate to bring up at a follow-up appointment for their MS. They also feel that their healthcare provider doesn't have the time, that they feel rushed into talking about other things. They also maybe don't think that their healthcare provider has enough of a skill set to help them with these concerns. On the flip side, when healthcare providers were asked about this, they too felt a little uncomfortable, a bit embarrassed about bringing up this topic with their patients. They did say that the time that they have with the patient nowadays particularly is spent talking about MRIs and disease-modifying therapies, and often not as much time talking about symptoms, and particularly this symptom of sexual function and intimacy. And so again, this symptom is overlooked. But let's talk about those common symptoms that people with MS have. Men and women have shared a multitude of symptoms. Men report often that they have difficulty achieving an erection and maintaining an erection. They often have said that sometimes they just don't have the libido. They don't have the desire for sex. And they also have reported difficulty with ejaculation and obtaining orgasm. Women, on the other hand, often say, I just don't feel like it anymore. I don't have the desire. I don't have that libido. I don't have the interest in sex anymore. They report discomfort in the genital area. They also report vaginal dryness and difficulty obtaining orgasm. There's help for these symptoms, and I'll tell you about help we have. For men who have erectile dysfunction, there are many medications that can be used. In 1998, when that little blue pill came on the market, we had an influx of men coming to our multiple sclerosis center because they wanted to talk about sexual function, and they were hoping that that little blue pill will help. There are multiple medications available to help men with erectile dysfunction. You just need to go ahead, talk to your partner, and talk to your healthcare provider about this. For women, there are water-soluble lubricants, as I recommended for Tracy, and there's also other medications that can be used to help decrease some of the odd sensations women have in the genital area. For the issue of lack of desire or decrease in libido for people who have MS, for both the men and the women, that's a little harder topic to discuss. Sometimes the concern there is the relationship, the intimacy, the communication between the couple. And often what I suggest to patients is that they set aside some time, make a date for sex with their partner, plan it out so that they both know that this is going to happen. And remember, maybe they can remember what pleasure they would get from such an activity. There's also other symptoms that affect sexual function with multiple sclerosis. Those symptoms of fatigue, bowel and bladder concerns, weakness, and spasticity can certainly interfere with comfort in sex. And again, there are many suggestions or recommendations to help with that. If people are fatigued, maybe you need to throw away that idea that sex has to be at the end of the day, when most people are pretty exhausted anyway. Maybe you'll consider sexual time in the morning when you and your partner have more energy. You may also consider medications that can help with fatigue and multiple sclerosis. You might even consider some exercise because we know that exercise can help boost some energy in people who don't have that energy. If there are bladder and bowel concerns that happen because of multiple sclerosis, talk to your healthcare providers about managing those symptoms. Emptying your bladder prior to sexual intercourse can help relieve that worry about a little bit of leakage of urine during that sexual moment. Also, having regular bowel movements can help with the general comfort of sex. Symptoms like weakness and spasticity can also be improved with medications, working with a physical therapist so that they can help you find a comfortable position so you and your partner can enjoy sexual activity. Stretching, light stretching prior to sexual activity might also help relieve some of that tightness that people have experienced. There are other symptoms like mood, and we know that folks who have MS can have depression or distress or whatever you want to call it, and mood can certainly affect how a couple's interaction is. I talked a lot about sexual function in terms of sexual intercourse, but there's more to sexual function than just sexual intercourse. There's intimacy, and in our lives there can be a variety of ways you can be intimate with another individual, in addition to sexual intimacy. The intimacy intellectually, the intimacy you have with another person with humor, the intimacy you have just for hanging out together. Those little gestures you can show your partner. Holding hands, back rubs, kissing. Whatever happened to kissing? Seems like people don't kiss enough anymore. And that's a nice, intimate response to another individual. If your mood is disturbed because of multiple sclerosis, counselors can help you. And don't be shy about talking with a counselor about some of these concerns, because they all play a part in who you are and your sexual function. It is my hope that you talk with your partner about your concerns. It is my hope that you open a discussion with your healthcare provider about your sexual function concerns and intimacy concerns. Yes, you have MS, but having MS does not mean the end of sexual, sensual you. You and your partner can continue to have a romantic, sexual, and intimate relationship.